Hi, you're looking at the welcome page for the Wisconsin Health Analytics Exchange. We're going to run a quick report, show you how easy it is to get information on provider performance. This can be used both for providers to understand how they're comparing to their peers, as well as purchasers to understand and patients to understand where to go to get care. Because we're asking questions about providers, we're going to the Provider Network Assessment, and we're going to be focusing on asthmatics. So we're going to define some episodes of care, and we want to take into account patient severity of illness, so we want them morbidity adjusted. That brings us to the data cubes. The data cubes hold pre-sliced and diced information so that the query time is almost instantaneous. It normally would take quite a bit of time to query records on 1.7 million individuals. I believe there are roughly 72 million line items in here. But the cubes make it quick and easy. So first, we're going to define the dimensions of our analysis. We have a question about ETGs, so we'll expand those. And drag the ETGs up here. We want to define the peers that we're working with to make sure that we're comparing physicians who treat similar types of patients. So we drag the peer definition up there. And we want patients to be mapped to individual providers, so ask for provider names. All right, once we have our definitions defined, we need to set some filters. So for ETGs, we're going to limit to asthma ETGs. And there's asthma. Now we're going to define the types of physicians we want to look at. We're going to limit it to primary care physicians. And so we have family practice, internal medicine, and pediatricians. And there we go. Now we're going to pick the measures that we'll look at. One thing we do want to know is to understand how many episodes of his clinic had. So we'll drag a count of episodes. We're also interested in a standardized rate of ER use, so we're going to pick ER visits per 1,000. We're also interested in understanding how sick the patients were that the clinic was treating. There's asthmatics come in varying levels of illness burden. So we're going to grab the ER visit index. That adjusts for the different illness burden that a clinic may experience. I want to focus on people who had more episodes, because the information is, the more episodes you have, the more accurate the information is. And there you go. We now have a report on the number of patients the number of asthmatics a clinic is treating, the number of ER visits per 1,000, and the ER index. So if we look at Aurora Advanced Healthcare on the Good Hope Road, they treated managed 312 asthmatics. There were 53 visits per 1,000, so if there were 1,000 asthmatics being managed by the clinic, they would have had 53 ER visits. And the ER visit index is 0.9. That's good. An ER index of 1.0 means they had exactly as many ER visits as one would have expected based on all of the doctors they're being compared to. A number less than 1 means they had less ER visits. A number more than 1 means they had more ER visits compared to other primary care physicians. And then this can be printed, PDF'd, emailed, whatever you want to do with it to communicate the information.